When I realized something was wrong with my right arm was when I was at work as a receptionist and I would go to hand something to someone over my desk. And it wasn't just a writing desk, it was a desk with a top on it with like to serve the public from. And if I'd go to hand them something, I found it difficult to raise the hand. It was a strain on my arm to do that.
Hope had shoulder pain from I think over 5 to 10 years, and she was trying different medications, injections couple of times, physical therapy, and all these measures tried to help her try to reduce the pain only to some extent, but she was suffering a lot with the pain. Finally, she had an MRI scan, and after the MRI scan, her treating doctor referred her to me for further management. So she was diagnosed to have a rotator cuff injury in her shoulder, and she was referred for a rotator cuff repair.
Prior to going to Health City, then I was referred to having therapy to see if it would help the muscles in the arm. But that really did not help. The pain was still there. I was still unable to use my arm the way that I needed to. I generally had to use the elbow and push it out and then up. I couldn't just put it up. So I stopped therapy after a while, and then after the pain got more pronounced, then that's when I sought help again and got the referral to go to Health City. And then that's when the surgeon was able to really evaluate the situation, and through the x-rays, MRIs, was able to determine that I needed a reverse muscle replacement.
Miss Hope, when she came to us, she had significant atrophy of her rotator cuff muscles, and because of that we opted to go for reverse shoulder replacement. See, she also had weakness of one of her external rotator muscles. So in addition to the reverse shoulder replacement, she needed something called a muscle transfer. This is not common. Usually we do the reverse shoulder replacement, but not the muscle transfer. It is reserved only for certain cases like Miss Hope, where I used a latissimus dorsi muscle to replace it to one of the rotator cuff muscles, so that she can get some external rotation. She will be able to turn her arm outwards and she can lift. So that makes this case challenging and unique.
I suffered for many years with this. I would say it was over 10 years, maybe 15 years, trying to just think that it would go away, or it was something that I didn't know that could be helped. But I'm sure glad that there was an answer and medical relief for it, because now I can use my hands very souply, and my movement is very free now.
When I saw her initially, if I asked her to lift her arm, she used to struggle and lift, and beyond this point she had to use her arm to lift the hand upwards. After the procedure, after the physical therapy, when she came to our clinic, there was a student, and I asked him, okay, guess where I have operated. So she tried to lift her both arms and he could not make out. In fact, he guessed the other side. So that's how the improvement happened over a period of time. And it's a very successful outcome in general. A reverse shoulder replacement by itself has a very good, faster recovery compared to a routine shoulder replacement, of course, when it is indicated.
I'm very fortunate to have been the patient of Dr. Naranjan. He had bedside manners, very respectful in his approach to me, in explaining things, putting me at ease. Just the way he touched me, it was very, just a real calming touch, caring touch. And he was very calm in speaking. And he wasn't just a monotone voice. It was a very caring voice that allowed a bond between us. And he was always detailed in whatever he was telling me, so that I wouldn't have reason to question anything that he said. So the movement in my arms have allowed me to dress easier. And also I was able to use my curling iron and my curling brush because I could get my arm over my head.
Miss Hope doesn't have to worry about her shoulder for next 15-20 years. She will be able to do all the daily activities what she loves to do. Gardening, she wants to go for swimming, she can do that. She want to exercise, she want to lift some weights. All those things she can do without any worry, without any fear of shoulder coming out, without any fear of pain. So yes, she can do anything whatever she wants.
To Health City staff, I appreciate you so much. Please don't change your attitude and your bedside manners. It means so much to healing.